We are going to begin on this Wednesday with the current COVID-19 situation in South Korea as the country makes its gradual transition to living with COVID-19. The country's health authorities are concerned about a potential uptick in cases, especially following the Halloween weekend.
Yes, the authorities are also concerned about a recent rise of infections among older people, even though they have completed their vaccinations. For more on this, we have our Choi Won-jong in the studio. Good morning, Won-jong.
Morning.
Now let's start with the current daily death toll right now. I believe the figure has been hovering in the 20s for a few days now, and 1 in 4 people who have died were actually fully vaccinated. Is that right?
That is unfortunately right. In the past 5 weeks, 1 in 4 people who have passed away due to COVID-19 were fully vaccinated. And in that period, authorities reported 389 deaths with 95 people fully vaccinated, meaning the recent rise in infections could increase the number of deaths too.
And do we know the reason behind this uptick in the number of COVID-19 deaths, despite the fact that the vast majority of senior citizens in South Korea are fully vaccinated?
Yes, the authorities said it's because more infections have been reported among the people above age of 60, and many people in their 60s used to or have underlying conditions which increased the chances of them becoming severely ill from COVID or dying later on.
So how much increase are we talking about?
So let's dive deep into this. According to reports on Tuesday, from October 24th to 30th, 420 cases that week were people aged over 60, and that's an 18.3% increase from the previous week. And this is actually the first time over 400 cases involving people in this age group were reported.
But I keep going back to what I was saying before. The fact is that most of these people who succumbed to COVID-19 in South Korea did have the double shot of the vaccine, correct?
That is correct, and I believe more than 91% of the age group have been fully vaccinated. These infections are breakthrough cases, and according to the reports, those cases are being reported from nursing homes and hospitals. Now, that being said, the so-called booster shots, additional vaccine doses, should be administered as soon as possible, as it appears that the effectiveness of a vaccine for these elders who were vaccinated early in the vaccination campaign has decreased a lot over time. Now, health authorities have decided to provide extra shots for medical workers first, beginning October 12th, and it will start gradually begin giving boosters to those who are past 6 months as fully vaccinated. And local medical centers will give booster shots on the designated days to prevent vaccines from being wasted starting in November. The medical centers will choose their own schedule for boosters. So if the designated days are Monday, Wednesday, and Friday, and the centers will vaccinate only on those days and will not do that on the rest of the week.
All right. Won-jong, shifting gears, we are now into our 3rd day of living with COVID-19, and what are we expecting for today in terms of infections?
So it's going to be much higher, unfortunately, and today's caseload is going to be, like I said, much higher than yesterday. Usually, as you know, the figures on Wednesday are higher than Monday or Tuesday. From midnight to 9 p.m. on Tuesday, 274 cases were reported, 951 more than the same time on the previous day. So today, unfortunately, like I said, the daily caseload will be around 2,500. Now, Seoul alone reported nearly 1,422 more than yesterday. Health authorities said earlier this week that the impact of the Halloween weekend might take a week or so before they're becoming evident.
We hope the situation doesn't get worse. Anyway, thank you, Won-jong, for your report, as always.
No problem.
We'll talk to you again tomorrow.
Thank you very much, Won-jong.